Medics in biohazard suits going from car to car testing everyone fleeing the epicentre of a virus outbreak. This was the scene on the main motorway out of Wuhan as the city went into lockdown. A transport ban came into force at 10 o'clock this morning. SWAT teams and soldiers were brought in to secure the main railway station, as all trains, planes and buses were cancelled. Road is now the only way in and out, through roadblocks and temperature checks. A population of 11 million people has been placed in virtual quarantine.
I'm grounded effectively, so I'm staying in my apartment, whereas I might have expected otherwise to travel around a bit, to move around a bit, to visit friends and get out and about.
This video from social media appears to show one of several hospitals in Wuhan where hundreds of panicked people have queued to be tested for the virus. Teams of cleaners have spent the day sterilising now empty subway stations.
I'm not declaring a public health emergency of international concern today. As it was yesterday, the emergency committee was divided over whether the outbreak of novel coronavirus represents a fake or not. Make no mistake, this is, though, an emergency in China. But it has not yet become a global health emergency. It may yet become one.
China is trying to contain this virus at a time of year when a third of its population is on the move. And most of the containment measures have only been introduced in the last 24 hours.
Millions of people will have already made their journeys, and some of them will likely have been carrying the virus. With an average incubation period of 10 days from infection to detection, it's therefore inevitable that the number of cases will keep rising as families come together for the start of New Year's celebrations tomorrow.
A desperate demand has developed for face masks. They are one of the only forms of protection against a virus which is becoming more widespread and dangerous by the day. Debbie Edward, News at 10, Beijing.